So hello guys, welcome back to my channel. So today in this video, as you can see over here, I'm going to talk about the branches of the internal carotid artery, especially the cavernous parts, because I've seen many people, I've taken lectures before, I have myself read about this before a long time back. I never used to go in much detail about the branches of the internal carotid artery. So previously also I have made a lecture about the internal carotid artery entire anatomy and its course, so you can go and check it out. I'll post the link in the description panel down there. So today the main aim of this video is to talk about the meningo-hypophyseal trunk of the internal carotid artery, which you can see in the cavernous part. Now, as we know that the internal carotid artery is divided into 7 parts, so it has got 7 anatomical parts. So the first part we all know about it. I'll just give you a brief discussion about this in like 30 seconds or something. So as you can see over here, so it comes off basically from the common carotid artery, which eventually comes from the left side arch of aorta. So as you can see over here, this common carotid artery at the level of C4 and C3, between C3 and C4 somewhat, divides into the external and the internal carotid artery. Now the very first part, as you can see over here, is the internal carotid artery. Now that's the cervical part, till it reaches up to a point where it enters into the carotid canal. Now I've removed a part of the temporal bone over here so I can show you the inside part as well. So as you can see, it has got the first is the cervical, also called as the parapharyngeal part. Then now this is a posterior view. This is the occipital bone and this is left side. So as you can see over here, it eventually takes a turn. Now this is the entry point into the skull base cranium through the carotid canal. So it takes a turn, goes medially, superiorly and anteriorly. As you can see, the carotid artery comes from posterior to the anterior in its entire course. So as you can see, this is the first turn which it is making actually. So as you can see, it transitions itself from the vertical to the horizontal part. Now that is the entry point of the artery from the neck into the petrous part. So this becomes the petrous temporal part of the internal carotid artery. So that's the cervical part. Now this becomes the first genu of the ICA. That's the posterior genu, as it is lying posteriorly, as you can see over here. Now if I give you a superior view, as you can see, it goes superiorly, medially and anteriorly. Now this is the first posterior genu. That's the transition between the cervical and the petrous part. Now as it goes anteriorly further ahead, now this was the vertical part, short vertical part, then the genu, and then the horizontal petrous part. Now the horizontal petrous part then further contains goes anteriorly and ascends vertically upwards. Now that's the point where it actually exits the petrous temporal part and it lies above the level of foramen lacerum, which is somewhere here below. So it then continues as the cavernous part. So what I'm going to show you today is the cavernous part of the carotid artery and its branches. So as you can see, this is a posterior lateral view. This is the actual area. Now this you can see over here, that's the clivus bone. You can see over here, that's the sella turcica for the pituitary gland over here, and that's the superior orbital fissure and the optic canal here. So as you can see over here, this is actually a case of the carotid artery in the cavernous region viewed from superiorly. So for a skull base surgeon, if he's trying to operate on a case of ICA, or a neurosurgeon, they're gonna have both the different views. So I'll be talking about in much detail about the cavernous part. So this is the cavernous part. Now cavernous part, as you can see, is a typical S-shaped part of the ICA. This is called as the carotid siphon. Okay, so that's the carotid siphon. So basically it has got 2 parts in the cavernous part itself. So the entry point from the petrous part of temporal bone into the sphenoid area is called as a short vertical segment. That's called as the paraclival artery, and the rest of the part in the cavernous sinus is called as the paracellar. Now I've got some cadaver photos as well, which I'm going to show it to you so that the basic idea of view is very much clear. Now as you can see over here on screen, this is a clivus, okay? Now this is an endoscopic endonasal view of a cadaver dissection. You can see over here, this is the left side of the patient. That's the cadaver, the cadaver. So that's the left side. This is the clivus over here. That's the pituitary gland, as you can see over here. So this is a left side, and this is the carotid artery I was talking about. This, you can see the Vidian canal and all. So the carotid artery, if viewed from anteriorly, is coming. So follow my cursor right here. So what you can see over here, that's the artery, which is the paraclival. This is the clivus, so corresponding to it would be the paraclival artery, and the rest of it is the paracellar, because it is adjacent to the pituitary gland, and hence it is called as paracellar. So if you can imagine, just follow my mouse cursor, which you can see in the red color over there. So here it starts like this. So it will come as a cervical part here, and then turn medially, anteriorly, and superiorly to form the horizontal, the vertical, horizontal, and the again the vertical segment of the petrous part of temporal bone. So it's gonna come like this. This is the cervical part. This is the petrous horizontal part, and then it's gonna enter the clivus region here, right here. So this is how it enters the sphenoid. So this is how I've showed this in entire detail in my previous video, so you can go and check it out. So today what I'm going to show you is the meningo-hypophyseal trunk, which the artery gives off right here, just at the place where the short vertical segment of the paraclival cavernous carotid artery enters and continues as the paracellar one. Now exactly as you can see over here, now this is also really important, at which point exactly the paraclival turns into paracellar. So as you can see over here, this is a supralateral segment of the carotid, which is nothing but the part which runs above the foramen lacerum and immediately transits itself into the paraclival, which is a part of cavernous sinus carotid artery. So as you can see over here, this is a pituitary gland. Just below the pituitary gland, you can see the bluish structure over here. That's the inferior intercavernous sinus. So at the lower border of the inferior intercavernous sinus, which you can see right here, starts the area, or you can say in the other words that this is the area at this plane, this line, the paraclival carotid artery ends and the paracellar actually begins. So the paracellar has got three parts: a short vertical segment, which you can see right over here, then it takes a turn laterally to form the genu. Now here is also a formation of genu, so you can see that's a posterior genu and turns around laterally to form the horizontal segment, and then it turns again upwards to form a anterior genu again over here. So we have two sites where the carotid artery has got two genus, two anterior genus and two posterior genus. One which you can see in the horizontal, or you can see the petrous part of temporal bone, and the other one which you can see in the cavernous sinus. So remember that the carotid artery has got two anterior and two posterior genus. This is like really confusing, but if you can go and read the text, you can see the same thing. So if you are still confused about this fact, I'll still show you, no issues. So if we can take a look at this 3D model anatomy right here. So this was the area where the first bend of the internal carotid artery occurs, right? And it goes, this is a part where it transitions into from the cervical into the petrous part. That's the first genu of the ICA, and that's the posterior genu over here. Then we have a short horizontal segment, and then it takes one more turn right here to form into the paraclival cavernous part. That's the second genu right there. That's called as the anterior genu, because this is posterior and this is anterior. Similarly, when the cavernous carotid artery starts over here, we have two genus. One is the posterior genu at the level of the inferior border of the pituitary gland. If I can show you on this cadaver dissection over here. So this is the inferior border of the pituitary gland where the turn takes place, and that's the posterior genu. Short horizontal segment is there, and again at the level of the almost superior border of the pituitary gland, the anterior genu, you can see the anterior genu as well. So this is how the genus of the internal carotid artery work. So now coming on to the main point, after having explained all the basic anatomy of where you can actually see which part of the ICA, now I'm going to take you towards the photograph of the cadaver dissection, where you can actually see the same photograph, but in this case we have just lateralized the internal carotid artery, which is paraclival, as well as the parasellar. So once I lateralize the carotid artery, you can see basic structures right here. So there is one trunk. Now we have got two main trunks of the internal carotid artery in the cavernous part, and that is, the first one is the meningo-hypophyseal trunk, and the second one is the inferior lateral trunk. So in this video I'll be talking in detail about the meningo-hypophyseal trunk only, and in the next one I'll be talking about the inferior lateral trunk as well. So as you can see, if I could try to zoom this picture for you guys, you can see this is the meningo-hypophyseal trunk, short form MHT over here. Actually this is a trunk given off just below the posterior genu. Now, as I told you some time back, this is the inferior intercavernous sinus, and at the lower margin of the inferior intercavernous sinus will be the transition from paraclival to parasellar carotid artery, right? So and then we have a short vertical segment of the parasellar carotid artery, and then we have, at the level of the inferior border of the pituitary gland over here, the posterior genu just before the turn. So as you can see, you have to remember that the medial hypophyseal trunk, or you can say the meningo-hypophyseal trunk, so it's M for meningo-hypophyseal trunk, is M for medial. So it will stay medial. So the inferior lateral trunk is on the lateral aspect. The meningo-hypophyseal trunk, being M as medial, will be always on the medial aspect. This is a huge misconception that people sometimes make, is where you can find the both trunks. So it's going to be very easy for you if you remember that M is for MHT, M is for medial, and the inferior lateral trunk is obviously the lateral one. Okay, so we can see something coming out like this. It trifurcates. Okay, this trunk is given just below the posterior genu of the cavernous carotid, and it has got three divisions. Now what you can see over here is, if I can just try to zoom out again to have a better understanding, you can see three structures right here. So you can see 1, 2, and 3. So these three, as you can see on the labeling over here, that's the BCA. That's nothing but the Bernasconi Casanari artery. Now this artery is named after an Italian surgeon, Bernasconi Casanari. So it's a difficult name to understand, but you can also call it as the tentorial artery, because it supplies the tentorium as well. So the second one is the IHA, which you can call it as the inferior hypophyseal artery, and the third one is the DMA, which you can call as a dorsal meningeal artery. Now this dorsal meningeal artery is also called as the dorsal clival artery. So these three are the branches of the trunk called as the meningo-hypophyseal trunk, which is a trunk coming out of the posterior aspect, medial surface of the carotid artery in the cavernous part, just below the posterior genu. So I hope this is this really helped you out so far in understanding the branch or trunk of the carotid artery in the cavernous part. So further ahead, if we talk about it, the arteries in detail, is that normally most of the times, like very commonly, these three branches arise from the trunk itself, but very rarely or sometimes you can see, a surgeon can see that these three can individually or independently arise directly from the carotid artery over here. So that is very rare, but if you do find that, if you're a skull-based surgeon or a neurosurgeon doing surgeries out there, if you do see that, please make a note of it, and do let me know if you kind of see something like this in your future. So talking about the first one is the inferior hypophyseal artery. Now the inferior hypophyseal artery, as the name suggests, is the inferior branch and is the hypophyseal artery. Hypophyseal stands for the pituitary gland, and definitely it's going to supply the pituitary gland. So there are two arteries, the inferior hypophyseal artery and the superior hypophyseal artery. Now the superior hypophyseal artery, mind my words, is a branch of the ophthalmic segment of the internal carotid artery, which is the C6 part. So if you really want to know and learn about the anatomy of the ICA in detail, please go to my previous video, and I have posted the link for that in the description panel below. So it comes from as a branch of the ophthalmic segment of the internal carotid artery, and this one is the inferior one. So the inferior one, if I can show you the next photograph over here, which is kind of more easy for you to understand, and if I can zoom this for you guys, as you can see over here, this is the carotid artery which has been lateralized, You can see a huge trunk coming out from the posterior aspect medial surface, and giving off 3 branches from this trunk is the one which is we are talking about right now, is the inferior hypophyseal artery. Now the inferior hypophyseal artery, as you can see, ascends upwards, okay, to supply the posterior lobe of the pituitary gland. Always remember that the main supply of the inferior hypophyseal artery is always going to be the posterior lobe of the pituitary gland. And if sometimes it has to supply the anterior lobe, it will supply the periphery or the margins of the anterior lobe of the pituitary gland. So it does that. So this is how you can see that it goes upwards, inferior hypophyseal artery. I think that's about it, that it supplies the pituitary gland as well. Okay, so as you can see over here, the second one is a DMA. Now the DMA stands for dorsal meningeal artery, also called as the dorsal clival artery. You can see an instrument which is trying to separate or trying to enter into the Dorello'S Canal. Now I'll talk about the Dorello'S Canal as well in short in this video itself, because we can also see the Dorello'S Canal right here and the 6th cranial nerve passing right behind the dorsal meningeal artery. So it is also really important to understand the concept of the Dorello'S Canal when you're dealing with the meningo-hypophyseal trunk as well. So also in my next lecture, I'll be talking a lot about in detail about the Dorello'S Canal and in detail the anatomy of the Dorello'S Canal along with the pathway of the abducens nerve. So that is going to be my next lecture, so be sure to check in whenever I upload a video. So moving on back to this video, we have the second one, which is the dorsal meningeal artery, that's also called as the dorsal clival artery. This artery, as you can see over here, is going inferiorly, and it supplies the superior surface, or you can say the superior part of the clivus. It actually supplies the dura of the superior part of the clivus. So that's one thing you have to remember. Also, as you can see, it is in real close relation to the 6th cranial nerve, the abducens nerve in the Dorello'S Canal right here. So it also supplies the proximal part of the 6th cranial nerve, that's the abducens nerve. So 2 points you got to remember about the dorsal meningeal artery is that it supplies the superior part of the clivus, that's the dura of the superior part of the clivus, and the second thing, it supplies the proximal part of the 6th cranial nerve, that's the abducens nerves. So we had this inferior hypophyseal artery, then the dorsal meningeal artery, and the most confusing artery of all time. The name itself is very confusing because it's a huge name, Italian name, so it is called as Bernasconi Casanari artery. A very complicated name, but still remember it as a BCA. Okay, also called as the tentorial artery. Why? Because commonly it supplies the tentorium as well. Now also you can remember that one more important point, the inferior hypophyseal artery and the dorsal meningeal artery over here, they both are connected to each other, they anastomose with each other as well as on the opposite side as well. So they kind of form a circulation kind of thing. So it is also called as something circulus arteriosus, I guess. So it forms something like that on both sides. So remember these two arteries, inferior hypophyseal artery and the dorsal meningeal artery, both sides are connected to each other. Okay, so the third one, there's one more point about this, is that so this anastomosis also helps in supplying the cranial nerves, which you can see in the cavernous sinus right here. So basically this is nothing but the area of the cavernous sinus, and it supplies the cranial nerves in the cavernous sinus as well. So this is the real importance of the meningo-hypophyseal trunk if you know about it. So I was going to talk about one more thing, is the Dorello'S Canal in short about in this video itself. So let me just zoom out this and I can show you. Okay, wait a second. So as you can see over here, what you can see over here is the that's the clivus, that's the choana below, because it has been the floor of the sphenoid has been actually dissected, drilled out completely. So to have a better picture, so the floor of the sphenoid has been totally taken off, and what you can see over here is that carotid artery and the nerves and the branches itself. So whatever you see in blue over here is the venous structure, and that is nothing but the cavernous sinus all over. Okay, so what you can see over here is IPS, Now, what does IPS and your SPS stands for? Now, we all know that I have done a lecture on the dural venous sinuses before, both the anatomy and the 3D anatomy as well, in 2 different videos. So if you have watched that video, you will understand that this is a superior petrosal sinus and this is the inferior petrosal sinus. Now, if we are dealing with the Dorello'S Canal, we should know that the Dorello'S Canal consists of 2 structures. That's the 6th cranial nerve, that's the abducens nerve, and the inferior petrosal sinus. So if you get a question or a viva question, or if anyone asks you that what is the content of the Dorello'S Canal, you have to remember it has to be inferior petrosal sinus and the 6th cranial nerve both. Okay, so in the next photograph, if you can see, this is a very much magnified photograph. You can see it here. This is the inferior petrosal sinus. That's the Gruber'S ligament. Okay, so that's a Gruber'S ligament. That's the inferior petrosal sinus. You can see over here. DC, we can see what it stands for, Dorello'S Canal. That's the dorsal meningeal artery. That's the 6th cranial nerve going laterally. Now, I guess in this case, the carotid artery is turned medially. Until now, it was turned laterally, but imagine this carotid artery is now turned into this side, and we are going to have an image of this side. So this is what we have right now. So you can see that we have a Gruber'S ligament over here. Now, to understand the basic anatomy of the Dorello'S Canal, which I'll be teaching you in the next video, but I'll talk about it in very brief right now, is that Dorello'S Canal is nothing but a osteofibrocartilaginous canal, which mostly formed by the dural invagination, okay, in the area between the petrous apex and the posterior opening of the cavernous sinus. So it's called as the Dorello'S Canal, and through which you can see the abducens nerve passing through and the inferior petrosal sinus as well. So basically, the inferior petrosal sinus is situated superior to the abducens nerve, and the abducens nerve, as vice versa, is inferior to the inferior petrosal sinus. All these things should be really important when you're operating on a patient. You have to remember that. So it's really going to be very bloody. Because this is a cadaver, there's no blood at all. But if you are doing a live surgery, that's going to be a lot of bleeding out there, because this is a huge venous structure. So always remember that the 6th cranial nerve is lined throughout its entire canal by the arachnoid matter, above which we can see the dura mater. Now there's going to be blood all over. So the only thing which separates the nerve from the blood all over the place is the arachnoid matter, which covers the nerve all throughout the canal. So this is in short about the canal and the contents and the Gruber'S ligament. The Gruber'S ligament, nothing but the petroclinoidal or the petrosphenoidal ligament, which is the roof of the. So as you can see over here, that's the roof. This is a canal right here, and that's the roof of it. Okay, that's the roof of the canal. That's the Gruber'S ligament. So I think that's all the structures, if you can see on a 3D anatomy model now. I'm watching this on a lateral aspect, so I've removed the temporal bone, a part of it, so you can see the inside of it. So all those things are going to be present over this region. Now this was the clivus, right? This was the clivus, as you can see over here. Wait a second, this was the clivus. If I take a second picture, yeah, this was the clivus over here. This is the left side. Okay, this is the clivus center. That's the left side. That's the pituitary gland, and the branches are right here medially. So if you view that the same thing on the 3D model, this was the clivus right here. This entire thing is clivus. Okay, this entire thing is clivus over here. This is a sella turcica. The pituitary gland will be right here. This is a sphenoid bone. So this is going to be the entry point, and this is going to be the area where medially the meningo-hypophyseal trunk will be present. So I hope this concept about the meningo-hypophyseal trunk, which is a trunk given off by the ICA in the cavernous part, is very much clear to you guys right now. So about this video, if you have any doubts or any queries, please feel free to comment in the section below. I'll be always replying to your sections, your doubts, whatever queries you have, whatever doubts you have in surgeries, theory, questions, whatever be it, ENT, head and neck, especially the skull base. So because I'm specializing in skull base surgery, so I'll be really up to it. So I hope you like this video. If you do like it, keep subscribing and keep liking, and till then, take care guys.